Thank you for taking the time to attend this virtual presentation. Today, I'll be sharing results from a study titled Patterns of Changing Pregnancy Intentions Among Women Living with HIV in Canada. My name is Lashanda Skerritt, and I'm an MD-PhD student in Family Medicine and Primary Care at McGill University in Tiohtià:ke, or Montreal, Canada. I'd like to start by acknowledging how privileged I am to live and work on the traditional lands of many First Nations, including the Kanien'kehá:ka of the Haudenosaunee Confederacy, the Huron-Wendat, Abenaki, and Anishinaabe. Today, women living with HIV can conceive with effectively no sexual HIV transmission risk and very low perinatal transmission risk. The contemporary pregnancy intentions of women living with HIV in Canada are poorly understood, and this is evidenced by high rates of unintended pregnancies, as well as low uptake of prescription contraceptive methods, such as long-acting reversible contraceptive methods, compared to HIV-negative women. Additionally, previous studies have examined pregnancy intentions at one point in time. Understanding reproductive intentions or pregnancy intentions and how they shift over time is key to delivering appropriate reproductive health care and counseling. The objective of this study was to measure and compare the pregnancy intentions of women living with HIV over time and to examine the relationship between pregnancy intention within 2 years and subsequent pregnancy. To address this objective, we analyzed data from women living with HIV enrolled in the Canadian HIV Women's Sexual and Reproductive Health Cohort Study, or CHIWOS. CHIWOS is a longitudinal community-based participatory study conducted by, for, and with women living with HIV in 3 Canadian provinces. Pregnancy intentions were measured based on women's responses to the question, "Do you intend to become pregnant in the future?" This was asked at each of the 3 survey waves. Responses were categorized as either yes, no, or unsure. We used descriptive statistics to analyze demographic survey data as well as pregnancy intention data at each survey wave. Sankey diagrams were used to illustrate shifts in pregnancy intention over time, and logistic regression modeling was used to estimate the relationship between intention to give birth within 2 years and subsequent pregnancy. 1,422 women enrolled in CHIWOS. We excluded women 15 years of age or older at baseline, women who reported that their menstrual status was postmenopausal, women who were assigned male sex at birth, women who reported being unable to become pregnant for other reasons, women who preferred not to answer the question about their pregnancy intentions, and finally, we also excluded women who were lost to follow-up over the study period. So our final analytical sample included 284 women. Here is a summary of the baseline characteristics of the 284 study participants. The median age was 36 years, with an interquartile range of 31 to 40. The majority of women identified as African, Caribbean, or Black were single or not in a relationship, had at least 1 child, and over 85% of women were currently on antiretroviral therapy. At baseline, 43.3% of women did not intend to give birth in the future, while 41.9% did and 14.8% were unsure. Between baseline and 18 months, 29.6% of women changed their pregnancy intention. Between 18 and 36 months, 26.8% of women changed their pregnancy intention. Over the total 36-month study period, 42% of women had some change in their pregnancy intention, with 25% of those changes being from intending to become pregnant to not intending to become pregnant, and 13.1% of the changes being vice versa, so from not intending to become pregnant to intending to become pregnant. We also stratified pregnancy intention and shift by age group. So among women 35 years of age and younger, 46% or 63 of 136 women changed their pregnancy intention over the 36-month study period. compared to 37.8%, or 56 of 148 women who were over the age of 35. We assess the relationship between women's pregnancy intentions within 2 years and pregnancies in the subsequent 18 months. So the second column in this table shows the prevalence of pregnancies in the subsequent 18 months by women's 2-year pregnancy intention. So for example, among the 58 women who reported at baseline that they intended to become pregnant within the next 2 years, 9 or 15.3% of those women had at least one pregnancy in the subsequent 18 months. Among the 184 women who at baseline reported that they did not intend to give birth within the next 2 years, 23 or 12.5% had at least one pregnancy within the subsequent 18 months. Among the 42 women who were unsure, 6 or 14.3% had at least one pregnancy in the subsequent 18 months. In logistic regression modeling, pregnancy intention was not observed to be strongly associated with subsequent pregnancy, and this was true after adjusting for potential confounders. This figure shows pregnancy outcomes per 100 women over the 36-month study period. Among the 119 women who reported intending to become pregnant in the future, there were 44 pregnancies reported. 25 of these ended in live births and 3 were terminated. Among the 123 women who did not intend to become pregnant, there were 30 pregnancies over the study period, of which 13 ended in live births and none were terminated. And among the 42 women who were unsure about their pregnancy intention at baseline, there were 8 live births and 2 terminations. And these values here in this graph are normalized per 100 women. Among this sample of women aged 16 to 49 years of age and of reproductive potential living with HIV in Canada, we observed dynamic and diverse pregnancy intentions over the 36-month study period. Changes in pregnancy intention were more common among women 35 years of age and younger. Over 1/4 of women changed their pregnancy intention over 18 months, and 42% did so over 36 months. Subsequent pregnancies were not found to be strongly associated with initial pregnancy intentions, and this may be explained by the dynamic nature of pregnancy intentions that we observed in this study, but it can also be shaped by the larger context of women's lives and the factors that influence choice or lack of choice in becoming pregnant or avoiding pregnancy. This also underscores the need for ongoing reproductive discussions between women and their healthcare providers. There are some important study limitations to consider. First, we excluded women living with HIV who were missing longitudinal data on their pregnancy intentions or who were lost to follow-up. Secondly, social desirability bias may have led to the underreporting of intentions to become pregnant. However, a community-based approach, which included interviews led by women living with HIV trained in data collection, was used to help mitigate this bias. Women living with HIV who desire to become pregnant in the future may also be more likely to participate in a study on sexual and reproductive health among women living with HIV. And finally, our study was only powered to detect strong associations between pregnancy intention and subsequent pregnancy. The findings from this study have important implications for family planning counseling for women living with HIV. To support the dynamic, contraceptive, and pregnancy planning needs of women living with HIV, healthcare providers should engage in ongoing discussions with women, helping to normalize these discussions and provide the counseling and support that aligns with women's evolving reproductive health needs. Discussions need to be left open so that women can discuss their pregnancy intentions as they evolve and receive the appropriate counseling and support that aligns with those evolving needs, and considers the social context and power dynamics that influence pregnancy decision-making. I'd like to thank the research team involved in this project, including the peer research associates. I'd also like to thank the funders and most of all the women living with HIV who participated. I'm happy to take any questions, and if you'd like to reach out to me for more information on this study, please feel free to send me an email.